Namaskaram. We are all here in this campus for a new beginning. The TEDx event today is premised on a very poetic theme, musings in twilight. And from what I've understood is, this is to capture those elegant stories that make a silent revolution. We are all here to speak of one such story. And I'm very proud to say that I'm here to share one such experience, one such project, which is always close to my heart, being a parliamentarian. On 31st August 2022, we created history by announcing the project called Cup of Life. And this project entered into the Guinness Book of World Records for one of the most biggest menstrual hygiene drive across the globe. And we all know, we all have a lot of stigma related to this. Whenever we speak about menstruation, menstrual hygiene, menstrual cycle, however advanced we are, we speak that we are in Kerala, one of the most advanced, educated, and in terms of health care, we are in the forefront compared to the other states in the country. But again, we all have taboos and stigmas related to that. I, being a small boy, when I was in school or in college, there was always this coded word. We used to say in schools and colleges about a bread packet. In those days, sanitary napkins were in packets, in big packets, and therefore carefully wrapped in newspapers. And it was very secretively distributed, even in my school when girls used to use. Then, in colleges, we used to always secretly say, the bread packet has arrived. So, and I, in my entire life, during my school days or college days, have never purchased a bread packet for my sister. From the bread packet, when I became a member of the Legislative Assembly in 2011, I made sure that I wanted to craft a journey, a developmental journey. And that shouldn't be just confined to always, development shouldn't be confined to roads, highways, or kind of infrastructure you build. So I always believe that what according to us is development. Development is not just based on the kind of infrastructure a country possesses. Apart from that, it should be sustainable and it should be inclusive. And it should always include the last man of a society, last person of a society. And when my wife told me that you should do something out of the box, we crafted this project called Breaking Barriers. In government schools, we made sure that everybody who has a 1 rupee coin will get a sanitary napkin. And that sanitary napkin would be not just for the students, but it should be kept in an open place so that boys can see, the other people can see. And there is something, a message in that. When you dispose a sanitary napkin in your school, especially in a government school, if it is dropped in the closet, the entire system gets clogged. And in government schools, you know, it takes weeks and months to repair the entire system. So we made sure that there is an incinerator as well kept at the restroom or in the toilet or in the ladies' room, so that we can make sure that is disposed properly. So the idea was to open the system to make sure that this is an open system. My classmate is using one, they are disposing it well. And the idea was successful. It got carried to 150 schools in my parliamentary constituency when I became the member of parliament, from 25 schools. So this was a paradigm shift. Right from the 25 government school to the 150 government and aided schools, people started using it very well. Students started using it very well. The entire system of openness. I wanted to prove that, our team wanted to prove that this is not just for girls or my classmates. This is an open system. I can go and get it for my sister or my mother or for my friends. This was quite open. So there are a lot of studies which show the number of sanitary pads used, there are money involved in it. There are a lot of stuff which have already been discussed. Right from the project, we made sure that this particular project would be having the kind of impact it posed on the society was a triple-layered effect, right from the environmental aspect, right from the economical aspect, and right from the social aspect. We understood that the kind of impact it made in our society. Because Kochi is a place where we don't have a proper waste management system or disposal system, whereby there was humongous amount of waste produced in many years. So the kind of environmental impact this transition would have. On a very fine day, a friend of mine, Parvati Tirot, the famous actor, told me that why don't you start with a menstrual cup, which was the turning point. On a day, on the International Women's Day, we made sure that we wanted to start this Cup of Life campaign. There began the birth of Cup of Life. We decided to distribute 1 lakh cups, but the idea was not just distributing 1 lakh menstrual cups, but the entire project was to have a proper campaign whereby people understand, as I mentioned, the impact of using a menstrual cup, which had a lot of impact in the future. So the kind of number of sanitary napkins which ranged from 5,000 to 15,000 was in a lifetime, if you multiply it, studies show that multiply it with the millions of menstruating persons using it, the amount of waste generated would be humongous, which can be reduced by the cup. So how can a parliamentarian decide the quality of the cup? So that is when all these stakeholders came into place. We decided to have a financial partner, reliable financial partner, because MLA MP funds cannot be used for individuals. So we very clearly had a decision to go for a CSR funding, which we gained. Apart from that, who will do the expertise in this particular field? So the Indian Medical Association of Cochin gladly came and agreed to do the part where they very clearly prescribed we need platinum cured silicon. We invited vendors who produce platinum silicon cured menstrual cups. The safety was ensured. The financial stability was ensured. We clearly told the vendors, and you won't imagine the amount we spent on a cup was 49 rupees, including the branding of the pouch and the box. You know how expensive it is in the society otherwise. So 49 rupees. Apart from the cost of the cup, the intense campaign we had in the many months following that. As we all know, a lot of organizations, including the Kudumbashri, the Asha workers, the Anganwadi workers, the doctors, the students, the many different organizations, 126 organizations in Cochin, joined together with the Indian Medical Association. We had around 1,000 master trainers for the project. 1,000 master trainers were trained from each organization, 6 from each organization, so that they can go to their particular fields, and they made sure that this particular campaign is reached. The health benefits of this, the social impact of this, the environmental impact of this, the economical impact was very well discussed. And you won't believe that a parliamentarian standing in front of you now can make sea folds and butterfly folds and whatnot with a menstrual cup. So this was the transition we had. So we had a lot of things to follow. A lot of celebrities joined our campaign. We had a small short movie made. We had a lot of discussions around this. We had a campaign inside the metro where we spoke about Arthavum Aravadum. Was a beautiful discussion we had. We had cyclothons followed. We had short movies, and we had presentations from different parties. And the most interesting, I couldn't explain how this campaign was Feel the Pain campaign. Feel the Pain campaign was done in public spaces. I was amazed to see, I was flabbergasted to see the kind of reaction women gave, because the artificial menstrual cramp was given to boys and men. Inside malls, in public spaces, I have never seen women so happy in my entire life when the man go through this pain. And it was not just about the physical pain I wanted to share, it was about the emotional swing attached to that when a menstruating person goes through the particular phase. And the entire campaign was based and discussed so that not just this could be a point of discussion, but they would understand, the society would understand what exactly the menstruating people are going through. So what is the impact? The outcome was that we, Kochi, together, transformed, symbolized a progressive path. We entered the Guinness Book of World Records for the biggest menstrual hygiene drive. Our CSR partner, who did the study after that, the impact study, we were amazed to see the kind of results, 70% conversion rates, of which the cup was distributed and 70% people started using it. Rajagiri College did a study on this, presented a paper on this. The Chester University in the United Kingdom has made this as a case study. The British Broadcasting Corporation, BBC, made a big story on this particular project. So the local influencers, government, district administration, Kudumbashri, everybody joined hands. And the impact was huge. The government of Kerala distributed the cups using 10 crores of rupees in their budget. I made a private member's bill in the parliament, whereby the impact was that every university in Kerala now has a 2% menstrual leave for the university level students. We pooled funds with many different organizations. The campaign is taken by many different organizations. And the impact to present this particular private member's bill created a lot of discussion amongst the local self-governments and the governments. And we started a uniform campaign. The Breaking Barriers to the Cup of Life was an immense campaign. This thrown wide open turf is now ripe for you. The right time for the youth to enter. I repeatedly request, especially to the men of this crowd, menstruation is a part of our collective human history, experience, and legacy. Let's break the barriers and take forward this bloody revolution. Thank you.